Thank you for listening to Depictions Media Radio.
Thank you very much, and bonjour à tous. Today, we'll provide the latest update on the national epidemiology and modeling work that informs the ongoing management of COVID-19 in Canada. Since the peak of activity in the spring, we've made tremendous progress both in reducing COVID-19 disease activity and increasing vaccine coverage. This has enabled the lifting of many public health restrictions across the country. But as we've seen in recent weeks, that comes with some expected increases in daily case counts. However, with ongoing efforts to increase the proportion of fully vaccinated Canadians and continued vigilance with public health advice, we could keep infection rates lower and reduce the risk of a strong Delta wave that could exceed healthcare capacity in the fall and winter.
Bonjour à toutes et à tous. Aujourd'hui, nous ferons le point sur les travaux d'épidémiologie et de modélisation effectués au pays qui orientent la gestion continue de la COVID-19 au Canada. Depuis le pic de l'activité au printemps, nous avons grandement réduit l'activité de la COVID-19 et augmenté la couverture vaccinale. Cela a permis de lever de nombreuses restrictions de santé publique partout au pays, mais comme nous l'avons constaté ces dernières semaines, cela s'accompagne de hausses prévisibles du nombre de cas quotidiens. Toutefois, en maintenant ces efforts pour accroître la proportion de Canadiens entièrement vaccinés et la vigilance concernant le Conseil de santé publique, nous pourrions maintenir les taux d'infection plus bas et ainsi réduire le risque d'une forte vague associée au variant Delta, qui pourrait engendrer un dépassement de la capacité hospitalière à l'automne et l'hiver.
So slide 1, although case counts are still 93% lower than the peak of the third wave, some resurgence in cases has been observed recently, with an average of over 640 new cases being reported daily over the past 7 days. Fortunately, the number of people experiencing severe and critical illness is still declining. The latest 7-day average for the number of people with COVID-19 being treated in our hospitals each day has fallen below 480 daily. Of these, on average, fewer than 225 were being treated in intensive care units, and there were an average of 8 deaths reported daily. Not surprisingly, the majority of cases, hospitalizations, and fatal outcomes are occurring among unvaccinated people.
Si on avance à diapositive 2, les provinces et les territoires du Canada ont signalé des baisses de l'occupation des hôpitaux après de nombreuses semaines d'une tendance à la baisse des taux d'infection depuis le pic du printemps. Ce développement a permis au système de santé de commencer à s'attaquer au retard, notamment de reprendre les interventions non urgentes, mais les travailleurs de la santé de nombreuses régions du pays continuent de subir des pressions permanentes. Avec une durée moyenne de séjour de près de 2 semaines pour les personnes hospitalisées en raison de la COVID-19 et peut-être beaucoup plus pour les personnes gravement malades, le nombre de patients hospitalisés s'accumule au fil du temps, prolongeant la pression exercée sur les services de santé.
Slide 3. The 7-day moving average for the national RT has been trending above 1 since July the 18th, after many weeks of trending out of an epidemic growth pattern with values below 1. However, with overall lower case counts and fluctuations in reporting frequency across provinces, this RT is somewhat unstable and sensitive to these fluctuations. While most jurisdictions remain out of the epidemic growth pattern, some are showing signs of increased disease activity and RT trending above 1 as restrictions have been eased. This growth is not unexpected, but it will be important to respond to new cases and clusters through testing, case finding, and targeted vaccination efforts to slow the spread. If RT remains persistently above 1 for several weeks, with predominance of the highly contagious Delta variant, we could expect to see a return to rapid epidemic growth, particularly as measures that slow the spread are eased.
Diapositive 4. Parmi les 4 variants préoccupants détectés au Canada, le variant Delta a augmenté par plus de 5 fois durant le mois de juin, représentant maintenant la majorité des nouveaux cas de variants préoccupants rapportés au pays. Actuellement, les personnes non vaccinées sont les plus exposées au risque d'infection et des conséquences graves. Cependant, la propagation dans les régions où la couverture vaccinale est faible présente un risque permanent d'émergence de nouveaux variants et de remplacement par ceux-ci. Nous devons donc rester prudents pour réduire la propagation, en particulier en ce qui concerne les variants qui ont la capacité de déjouer la protection conférée par les vaccins. Il est important de souligner qu'une série complète de 2 doses d'un vaccin contre la COVID-19 offre une protection considérable et que l'obtention d'une couverture vaccinale élevée au sein de la population devrait grandement réduire les possibilités de propagation du variant Delta, tout en réduisant largement le profil de gravité de la COVID-19 à l'avenir.
Slide 5. More than 48 million doses of COVID-19 vaccines have been administered across Canada since vaccination began in mid-December, providing an estimated over 81% of the eligible population aged 12 years or older with at least 1 dose of COVID-19 vaccine, and over 66% are fully vaccinated. Covering the last stretch as we shoot for the stars in high coverage, particularly for first doses, we require public health and communities to increase targeted approaches that reduce barriers and provide supports. Everything from more accessible locations and hours to information, language, and cultural outreach resources can make a difference to getting more of the population informed, confident, and protected.
Diapositive 6. Nous continuons d'observer des progrès encourageants quant au taux de vaccination dans tous les groupes d'âge. D'après les données sur la couverture vaccinale par âge en date de 24 juillet, la couverture vaccinale continue d'augmenter graduellement dans tous les groupes d'âge, allant de 70% des adolescents et des jeunes adultes à 95% des personnes âgées de 70 ans et plus ayant reçu au moins une dose. L'administration de la deuxième dose a augmenté à un rythme plus rapide au cours des dernières semaines. Maintenant, de 37% à 46% des adolescents et des jeunes adultes et plus de 89% des personnes âgées de 70 ans et plus sont entièrement vaccinés. Le fait que les Canadiens continuent de se faire vacciner a permis au Canada de se hisser parmi les 5% des pays où le nombre de doses de vaccins administrées par habitant est le plus élevé au monde. Cependant, le véritable objectif est de vacciner entièrement le plus grand nombre possible de personnes admissibles afin de leur offrir une forte protection contre la maladie symptomatique, la maladie grave et les nouveaux variants préoccupants, notamment le variant Delta. Il y a encore plus de 6 millions de Canadiens admissibles qui ne sont pas vaccinés. C'est pourquoi nous devons aspirer à la médaille d'or en matière de couverture vaccinale afin de protéger autant de personnes que possible.
Slide 7. With millions of vaccine doses administered, there have been relatively few cases reported in people who have received at least 1 dose of COVID-19 vaccine, and fewer still among those who are fully vaccinated. Remember, vaccine takes time to work, needing at least 14 days after the second dose to provide optimal protection. Based on data from 11 provinces and territories for mid-December to July the 12th, only 0.5% of cases were in fully vaccinated people infected 14 or more days after the second dose. What is most encouraging is that vaccination is proving to be highly protective against severe illness. The data show that 85% of hospitalized COVID-19 cases were unvaccinated, and only 0.7% of hospitalized cases occurring in fully vaccinated patients. Compared to cases in fully vaccinated people, unvaccinated cases were over 3 times more likely to be hospitalized. This aligns well with vaccine effectiveness studies that demonstrate strong protection against severe illness in vaccinated people.
Diapositive 8. La mise à jour des prévisions à court terme suggère augmentation de la croissance du nombre de cas cumulatifs, mais pas du nombre cumulatif de décès. Cette augmentation attendue de la croissance sur le court terme se reflète dans la trajectoire initiale de la prévision à plus long terme.
Slide 9. This updated longer-range forecast shows how the epidemic trajectory may evolve through early September. It suggests that we are at the start of the Delta-driven fourth wave, but that the trajectory will depend on ongoing increase in fully vaccinated coverage and the timing, pace, and extent of reopening. While some resurgence is expected as measures are eased, this updated model shows that if we maintain current levels of community-wide contacts, we would expect to see a modest increase in cases along the dark gray line trajectory. However, if cases increase along the blue line trajectory, it could mean that reopening is proceeding too quickly before enough people have developed immunity through vaccination. And we could expect to see a sharp resurgence by the end of the summer. We expect cases to be concentrated largely in younger, unvaccinated people, with further spread extending into the older, unvaccinated populations. Both higher case volumes and older age of cases could ultimately increase severe illness and hospitalization rates. This forecast reaffirms the need to take a cautious approach to relaxing public health measures, to remain vigilant and responsive to signs of resurgence, and to continue to increase first and second dose vaccine coverage.
Diapositive 10. Au fur et à mesure de la réouverture, le Canada reste à l'afflux de l'expérience du Royaume-Uni qui présente des hauts taux de vaccination comparables aux nôtres. Au Royaume-Uni, la trajectoire montre que même les pays avec une grande couverture vaccinale peuvent être témoins d'une recrudescence significative ainsi qu'une transmission élevée chez les jeunes personnes non vaccinées, en présence d'une vague associée au variant Delta. Heureusement, la trajectoire observée au Royaume-Uni montre l'effet protecteur de la vaccination contre la COVID-19 où une forte recrudescence des cas n'est pas associée à une augmentation marquée des hospitalisations. Prise ensemble, l'expérience internationale avec les vagues associées au variant Delta souligne la nécessité d'une levée des restrictions progressives et contrôlées jusqu'à l'atteinte d'une couverture vaccinale élevée à travers la population.
Slide 11. Not unexpectedly and in line with the longer-term forecast, this model shows that a resurgence of cases is likely this fall and winter when restrictive measures and individual precautions are lifted, as indicated by the vertical blue dashed lines. The scenario on the left shows that even with 72% vaccine acceptance in the 18 to 39-year-olds, there is still a risk that healthcare capacity could be exceeded with a Delta-driven wave, even when taking into account the very high fully vaccinated coverage in the older age groups. The good news is that there are still opportunities to reduce this risk. If the proportion of the fully vaccinated 18 to 39-year-olds were to increase to 80%, this could significantly reduce the size and impact of the resurgence, as shown in the scenario on the right.
Diapositive 12. Le Canada a fait d'importants progrès dans l'augmentation de la couverture vaccinale durant les derniers mois, mais nous avons besoin de plus de personnes admissibles vaccinées avec 1 et 2 doses. presque 6,3 millions de personnes n'ont toujours pas reçu de première dose et plus de 5 millions de personnes n'ont toujours pas reçu leur deuxième dose. Cet appel à vous retrousser les manches a pour objectif de viser les plus hauts sommets pour la couverture vaccinale. Avec seulement 5 semaines avant la fête du travail au Canada, cette période est cruciale pour augmenter une protection avant que nous nous rassemblions dans les écoles, les collèges, les universités et les lieux de travail cet automne. Cela signifie d'augmenter la couverture vaccinale complète au-dessus de 80% parmi tous les groupes d'âge, mais en particulier dans les groupes d'âge plus jeunes où la plupart des transmissions se produisent. La modélisation présentée aujourd'hui souligne d'augmenter la prise de la première et de la deuxième dose parmi les jeunes adultes peut avoir un effet important pour une meilleure protection pour l'automne et l'hiver. Merci, Miigwech.
So slide 12. Canada has made great progress on increasing vaccine coverage over the past month, but we need more eligible people vaccinated. Almost 6.3 million people are not yet vaccinated with the first dose. And these plus over 5 million people have not yet received the second dose. This call for arms is to shoot for the stars in vaccination coverage. With just over 5 weeks until Labor Day in Canada, this time is crucial for building up protection before we gather in schools, colleges, university, and workplaces this fall. This means increasing fully vaccinated coverage above 80% across all age groups, but particularly in younger age groups where most of the transmission is occurring. Today's modeling underscores that increasing first and second dose uptake in young adults can have a big impact in building up better protection for the fall and winter. Thank you. Merci, Miigwech.
Merci, Dr. Tan and Dr. New. Thank you. We will now open the phone line to questions. We ask that you limit yourself to one question and one follow-up. We will be taking your questions in both official languages. Nous allons prendre des questions. Nous vous demandons de vous limiter à une question et une question de suivi. Vous pouvez poser vos questions dans l'une des deux langues officielles. Operator, first question. Operateur, première question, s'il vous plaît.
Thank you, merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. The first question is from Mike LeCouture from Global News. Please go ahead.
Good morning, doctors. Thank you very much for doing this. I wanted to ask you, especially given what you presented today and seeing that Alberta has announced its ending pandemic response plan, the reducing testing and contact tracing, no longer really requiring positive COVID cases or close contacts to quarantine. Do you think that this is a safe policy given the spread that we're seeing right now of the Delta variant? And I wanted to know what your concerns are about Alberta's decision and whether or not they could have a national impact as people are traveling during these summer months.
Yeah, thank you for the question. And of course, we're in close touch with provinces and territories, including Alberta. And I think our role is, of course, to develop guidance, and it's up to the provinces to execute their own responsibilities and mandates. I'm seeing that Alberta is moving away from mandated approaches towards more individuals taking up responsibility and following best practices in terms of reducing the risk. Of course, I firmly believe that quarantine and isolation can help prevent the spread of COVID-19. Especially in light of the spread of the Delta variant. And I believe Alberta is going to strongly recommend to cases to isolate. And absolutely, if the policy in Alberta is not to mandate that, then I would ask that any individual who is diagnosed with COVID-19 or you think you may have it, please isolate, please get your test, and inform your close contacts And I think Alberta is not like all provinces are doing very well in trying to get their population vaccinated, but still has a ways to go. With say 75% first dose, you still have the hundreds of thousands of people not vaccinated can lead to pretty big potential for large clusters, outbreaks, and an escalation in the epidemic itself. So, of course, we advise prudence and caution. I think the members of the public have got used to individual protection and wearing masks, respecting physical distance, avoiding really crowded and closed spaces, ensuring ventilation is maintained and stepped up. Some of the still critical measures, but the bottom line is get vaccinated. There's still a ways to go in Alberta, and that's really important to do.
It's Dr. Newman. I would just add a couple of points to what Dr. Tam has obviously given in a very comprehensive answer, is that, yes, we recognize we have a federated system of government here in Canada with the individual provinces and territories having responsibility for the delivery of both healthcare and public health services. But certainly at the national level, we have very close collaboration. We have regular meetings with our counterparts in the provinces and territories. We exchange information, scientific and otherwise, learn from each other's experience. But I think your last point about the travel and so on, yes, certainly I think everyone is alive to the fact that there could be, as you say, knock-on effects to the other provinces and territories with travel within Canada, with residents of one province going to another province. Obviously, in this case, we're looking at Alberta. So that's something that's, I think, a bit of a live issue. The other provinces and territories will need to do and recognize what in their context might be most appropriate for their residents and to protect their public health and healthcare systems within their own provinces. So that work continues. Thank you.
Maybe just a reality check that Delta is going to be in every jurisdiction. And in addition to any kind of concerns about domestic travel, it's really Delta can be anywhere in Canada. So it's not just about domestic travel or spread. That's a very real reality. I mean, Ontario, for example, already have the mass majority of the new cases are Delta. So it's not just about the fact that Alberta may have a Delta-driven wave, or the others may well get in a similar position if the vaccinations, the vaccine rate going up is not as fast as the relaxation of measures.
And just as a follow-up, I wanted to ask you, today's press conference is largely concentrated on making sure we get first and second doses into arms. We're now seeing that Israel is one of the first countries to offer a third dose of the vaccine to its citizens on a wide scale. Given the concerning rise in Delta, is that something that Canada should be considering as well for people who already have their second dose? Should we be looking at starting to hand out a third dose?
Well, I think there's a lot of evolving data in this space, and the National Advisory Committee on Immunization is very much looking at the evolving information. Right now, there's not enough data to suggest that in Canada we would go into boosting as yet, but it is something that we're watching very carefully. The breakthrough infections are very few at this point. We're not seeing those breakthroughs occurring in the initially vaccinated populations as yet, but we're very much attuned to the potential for a need for booster, and we're getting operationally ready, whether it is looking at supplies, whether it's looking at the implementation side. The provinces are looking at, well, what if we did need one? How would we implement that? But we've got to get those first and second doses in for sure. That's got to be the priority. But we will, of course, be updating everyone should there be a change in the advice for boosters. We're very much alive to, the company like Pfizer submitting information and data that needs to be examined. But I'm also conscious of the fact that some of the data still suggests very good vaccine effectiveness at, say, the 6-month stage. But, of course, that might be without taking into account the Delta variant, which is evolving. So there's a lot of moving parts. But at the moment, I think people should be very heartened by the fact that the breakthrough infections are very few.
Thank you. Next question, please. Prochaine question.
La prochaine question est de Boris Proulx, Le Devoir. La parole est à vous.
Bonjour, merci de prendre nos questions. Ma question concerne la slide numéro 8. L'augmentation de la croissance du nombre de cas dans le pire des scénarios est prévue de faire exploser le nombre de cas, si je comprends bien, dès le mois d'août. Par contre, on dit que ça va pas être suivi par l'augmentation des décès. Pourriez-vous m'expliquer pourquoi les décès ne suivent pas et si c'est toujours aussi grave la pandémie sans qu'il n'y ait beaucoup de décès, là, si j'en crois ce graphique.
Merci pour la question. C'est Dr. New. Je peux commencer. C'est une bonne question et c'est quelque chose. On sait maintenant la situation est pas complètement, mais c'est beaucoup différent comparé peut-être aux premiers, deuxième et troisième vagues, parce que maintenant on a vraiment les vaccins qui sont un outil très important. On voit vraiment que les vaccins sont très efficaces dans tous les contextes et avec les données, on a même présenté aujourd'hui, on voit que le pourcentage, c'est moins qu'1% des cas qui sont complètement vaccinés. Donc, je pense que ce qu'on voit maintenant, c'est il y a pas un lien direct entre les cas, l'incidence des cas de Covid19 et les conséquences graves, la maladie grave, les hospitalisations et aussi les décès. Donc, c'est vraiment des bonnes nouvelles et c'est souligné point. C'est très important pour tout le monde de recevoir la première et aussi la deuxième dose pour se protéger contre les variants. Et c'est exactement ça. Il y a comme pas un lien comme avant parce qu'avec les vaccins, on voit que vraiment on a des bons résultats et on espère de continuer avec le plus haut couverture vaccinale possible. Donc, c'est ça pourquoi on voit déjà l'impact dans le sens positif et on va continuer avec nos efforts pour se faire vacciner le plus grand nombre de Canadiens le plus rapidement possible. Merci.
En suivi, si j'ai bien compris votre message, c'est-à-dire que on peut pas s'attendre à ce qu'il y ait autant de décès, de conséquences graves que les premières, deuxième, troisième vagues. Est-ce que ça veut dire que même advenant une quatrième vague très importante, comme vos modélisations le suggèrent, l'Agence de santé publique du Canada n'irait pas jusqu'à recommander des mesures sanitaires très importantes?
C'est toujours important maintenant parce que c'est un effort à l'heure actuelle de continuer avec les programmes de vaccination, mais on sait aussi avec la propagation des variants, en particulier le variant Delta, on peut pas assouplir les mesures de santé publique trop rapidement. Hein. Et aussi un autre défi, c'est aussi il y a des éléments dans la population peut-être sous-vaccinés. Donc, c'est toujours une possibilité d'avoir des étincelles, pour les éclosions. Donc, je pense qu'il faut continuer avec nos efforts avec la vaccination, mais aussi avec les mesures de santé publique, les mesures sanitaires à l'échelle de la population, mais aussi pour la protection individuelle. Toujours en regardant, en examinant c'est quoi l'épidémiologie, à l'échelle locale, parce que ça, c'est toujours le guide. Si vraiment on est dans une région pas vraiment touchée, peut-être que c'est possible pour les autorités d'assouplir les mesures de santé publique peut-être un peu plus rapidement que peut-être comparé à une autre région avec une plus haut taux, comme on dit, d'infection, parce que c'est aussi lié avec la couverture vaccinale. Donc, je pense qu'en ensemble, c'est vraiment important de continuer avec les programmes de vaccination, mais aussi on a constaté et souligné de assouplir les mesures de santé publique avec prudence et en examinant c'est quoi la situation sur le terrain avec l'épidémiologie. J'espère que j'ai bien répondu. Peut-être quelque chose d'autre que je peux ajouter si vous avez d'autres questions. Merci.
Merci beaucoup. Operateur, prochaine question, s'il vous plaît. Next question, please.
The next question is from Marika Walsh from the Globe and Mail. Please go ahead.
Good morning, doctors. Thanks for taking my questions. I have a few that I hope you can help me with. Slide 11 no longer gives any clarity on what the overall vaccination coverage target is. In the last update, it was 83% full vaccination coverage for all eligible people. Can you please tell me if that is still the target that Canada has, or as many other experts are saying, does that target need to be higher to avoid hospital capacity being exceeded? For example, some are saying 90% is what's needed among eligible people.
Mm-hmm. Yeah, and as you can imagine, capacity is different right across Canada. This is a national estimate in terms of red line. But as I was trying to explain, there's a lot to take in on this slide. The slide on the right where there's only very few scenarios that would touch the sort of red dotted line. That's with the 80% coverage. Including in those 18 to 39 years of age. We know already that the older populations have already reached that target. But if you supplement the great coverage that we've already achieved in those older age groups with a 80% coverage in the 18 to 39 years of age, you will then, the outcome is that you are very unlikely to exceed hospital capacity.
Okay, thank you for that. Can you explain then why slide 9's assumptions in the annex show that even if the assumptions are based on 90% of eligible people having their first shot and 85% of eligible people being fully vaccinated, and even with those assumptions, it shows the case counts exceeding the third wave from the spring. So are we not already on track then to exceed the third wave if we don't yet have the vaccination coverage of 90% first doses that this slide is talking about?
Mm-hmm. Yeah, there's a lot of different assumptions. So what the modelers try to do is model the real data as we go along. So when they observed that some of the age groups had hit 90% and other, another slide that showed the different spreads of vaccine coverage across different age groups, those models adjusted, as well as vaccine acceptance information from the younger age groups, where we think they would be heading and what kind of vaccine acceptance we need to avoid an inundation of the hospitals. So one slide is talking about cases and the other one hospitalization. And Dr. New, I think, was just trying to explain in the preceding answer that given the how effective vaccines are against severe outcomes, the cases may still go up without a concomitant massive increase in the severity indicators such as hospitalizations and deaths. So we're looking at different outcomes, if you like, in each of these models. Does that help? I'm not sure if I answered your question. One is about cases going up. The other one is about whether hospital capacity will be exceeded.
It's Dr. New. Maybe I could just add.
I do understand that. I'm trying to understand what the actual target is now that Canada is trying to reach with vaccinations. Is the target 80%? Is it 83%, which is what it was said in June? or is it 90%?
Well, I think it depends on what your final objective is. If it's not to inundate the hospital and reduce severe outcomes, we're saying above 80. So 83 is a very granular number, but for sure we can get there because we know that right now the first dose coverage of the eligible is about 81%. So I think that is perfectly reasonable. But I think we should go as high as possible. Whether you can get to kind of coverage that I think as high as possible is great. When you increase the baseline immunity or community immunity in the population, you're going to really help reduce severe outcomes. But certainly above 80, if we can get to 90, I'll be, hopping over the champagne for sure.
It's Dr. New. Maybe again, just another a few points, I think, to your question, Marika, because as Dr. Tam said, the slide 9 that you're referring to looks at projections in terms of cases. But what we're seeing more and more, and it's certainly the experience in the UK and other countries with high vaccination coverage rates, is sort of a bit of a disconnection, I would say, between sort of case counts and sort of the severe outcomes being hospitalizations and deaths. And the other assumption that you see on this slide 9, which obviously is trying to put a lot of complex assumptions and modeling data into a sort of a simplified slide, as you can see there. It also talks about the number of contacts between people, so that's another important element. So regardless of the vaccination coverage rate, we know that the vaccines are very effective, but there's no vaccine that's 100% effective. And the fact is that even fully vaccinated people, it's still possible that a small percentage of them could pass on the transmission to others. So the sort of the number of social contacts that each individual also has in their social circles and so on is very important to consider. So I think it gets into other areas. So of course, trying to get as high a vaccination coverage rate as possible is very important. But I think people also need to appreciate that what they feel comfortable in terms of their own risk assessment, what they do in terms of how many people they socialize with, even if they're vaccinated. Some people may still feel comfortable wanting to wear a mask, even if it may not be mandated, etc. So all of those things together are part of the mix. But you can see, yes, that's certainly the factor of the number of contacts alone. If that's also modeled in or put as something to be considered, you can see that, quote, it could lead to an increase in the number of cases that we get. But then, of course, as you say with the other slides, then the actual sort of outcomes of what is the impact on the healthcare system, that is in many ways related to the high coverage rate that we're trying to achieve with our vaccination. So hopefully that helps as well. Thank you.
Thank you very much. We'll go to the next question. Opérateur, prochaine question, s'il vous plaît.
La prochaine question de Pierre Saint-Arnaud, La Presse canadienne. La parole est à vous.
Oui, bonjour Dr. New. Est-ce que je suis curieux de savoir si dans les cas d'hospitalisation, est-ce qu'il y a des données qui nous parlent de conditions préalables? La question s'est posée à plusieurs reprises, à savoir si les personnes qui n'ont aucune condition préalable étaient aussi vulnérables à la COVID que les personnes qui ont des questions préalables, des conditions préalables. Est-ce qu'on a des données là-dessus?
Ah oui, c'est une bonne question. Merci pour la question. On sait en général, en principe, que oui, les personnes qui ont déjà les autres conditions médicales sous-jacentes peut-être sont plus à risque pour les conséquences graves et je suis pas mal sûr, peut-être à l'échelle des provinces et territoires, on a peut-être les données plus détaillées, mais à l'échelle fédérale, c'est peut-être plus difficile d'avoir comme toutes les données, mais c'est quelque chose, on continue à travailler avec nos homologues des provinces et territoires. Peut-être après, on peut-être voir si on a quelque chose on peut vous donner, mais pour l'instant, je sais que oui, je pense que dans chaque province et territoire, on est en train de collecter des données probantes comme ça. C'est quoi peut-être les conditions sous-jacentes déjà pour les cas qui sont dans les hôpitaux et même les unités de soins intensifs. Et c'est quelque chose peut-être souligné, peut-être si on a assez des données détaillées pour tous les pays. C'est peut-être quelque chose on peut-être présenter une future séance, mais pour l'instant, je pense qu'on n'a pas assez de détails comme ça. Merci. Dr. Tam, est-ce que vous avez quelque chose d'autre à ajouter ou non? OK.
En sous-question, en général, on ne rapporte pas de cas documentés de contamination par les fomites, c'est-à-dire par les contacts. Ça ne veut pas dire que ça n'existe pas, mais est-ce qu'on sait s'il y a effectivement toujours un risque? Je sais que par principe, le principe de précaution amène beaucoup les gens là, à se laver les mains partout où ils entrent, dans tous les commerces, il y a des trucs pour se laver les mains. Mais est-ce qu'on sait si oui ou non il y a de la transmission de cette façon-là, autrement que par les aérosols?
OK, merci pour la question. Je sais, la science continue à évoluer, c'est ça, c'est sûr. Et ce que je vois, et peut-être Dr. Tam peut ajouter que oui, il y a plusieurs façons de transmettre le virus. Et au début, on pense que peut-être c'est très important. Je pense que c'est continue d'être une façon. Une autre couche de protection, je peux peut-être constater, de se laver les mains fréquemment, mais avec les données probantes à date, on voit que vraiment le mode de transmission le plus important, c'est vraiment d'une personne à l'autre, avec les aérosols, on peut dire, vraiment dans l'air. Mais ça veut dire pas que ce n'est pas une bonne pratique, je peux dire, pour protéger, même peut-être pour les autres virus, les autres microbes, de toujours continuer les bonnes pratiques d'hygiène, peut-être, décontaminer les surfaces, tout ça. Mais si on parle spécifiquement pour la COVID-19, on voit que la majorité des cas sont liés vraiment de transmission d'une personne à l'autre avec des aérosols.
Merci. Allons à la prochaine question. Operator, next question, please.
The next question is from Jennifer Yang from the Toronto Star. Please go ahead.
Hi, thanks for taking my question. Last night, the Washington Post reported on some new information from the CDC, which I believe will be releasing some more data today as well. But essentially, they're finding new data that suggests viral loads in vaccinated people who have been infected are comparable to the viral loads that were detected in unvaccinated people in a large outbreak in Massachusetts. I was wondering if you've seen this data, if you've reviewed it, and what your reactions are to these findings.
Thank you for the question. I haven't actually seen the data, but like yourself, we've heard about some of the findings, and I'll be very interested in that. I think Delta is a formidable foe. We've known that. Just how formidable it is still sort of evolving in knowledge. So I think we look forward to the data in terms of further contribution to our knowledge. But I think what I heard is we knew the Delta variant is very transmissible, is the most transmissible variant. And I believe the data is going to show that it may be even more transmissible than we originally thought based on the information from the United Kingdom. But some of these studies are difficult to do, so it would be interesting to actually go through the information once we see it published. The other concept is, do vaccinated people transmit the virus? I think is the bottom line. Of course, vaccination is still really important. It's the number one thing people should go out and do. Once you're vaccinated, is it possible? The breakthrough infections are still very few. So the chances of you getting infected is probably lower, and certainly the severe outcomes. But what if you're asymptomatic and you're vaccinated, but you are multiplying the virus in your nose? Could you pass it on to others? I think is the ultimate question, and that the data might show. What does it actually mean then? It means that in those indoor settings, even if you've been vaccinated, maybe people should continue to wear a mask. Certainly when there's still a lot of unvaccinated people around, you don't want to spread it to others, even if you've been vaccinated. I do think some of the previous studies, which were limited in household transmission studies, shows if you're vaccinated, you may reduce transmission by, say, 50%, even though you yourself are protected. The US data may show something different. There's also they have other data. I think they have lots of data that may be coming out, which might show that there's a higher viral load, as you said. A higher viral load in one's back of your nose, etc., can well then result in an increased risk of transmission in others, even if you've generated enough immunity in the body to prevent yourself from getting sick. So I think that's an evolving space, but we know what works. We know what works for COVID-19. So continue masking, distancing, and as much as possible, particularly, obviously, if you're at risk, high risk of severe outcomes. If you're any enclosed setting, bigger settings, the 3 Cs, all of those things still apply, and they will help.
I'm wondering, though...
And get vaccinated.
Yeah. But I am wondering how much it changes the game if this data is validated that vaccinated people, when infected, can transmit just as effectively as unvaccinated people. What does that, imply for vaccination targets, for pandemic control measures going forward? And, the models you presented today, I wonder how much they would change if this data is to be verified and validated.
Yeah, so a highly transmissible virus and even higher estimations on transmissibility means you do have to reach higher targets to reduce those chains of transmission. That's the bottom line. Which So absolutely. I mean, people have thrown out different numbers. People are trying to estimate how much vaccination, but how much underlying infection there's already in the community also, helps you adjust what vaccination target should be. Compare to the United Kingdom, for example. I don't think Canada has had as much of immunity from infection itself, which means we should strive for as high as possible. I mean, there's many areas of Canada that hadn't seen much infection. So for those areas, as I say, shoot for everybody. That's what you really should be shooting for in order to just minimize risk. So is it not about completely breaking down all chains of transmission anymore? It is. We absolutely are trying to keep things manageable so that the serious outcomes are very much minimized. And we still see really effective, really great vaccine effectiveness against severe outcomes. As I said before, we will monitor to see if there is any need for boosters. But I think we're in a slightly precarious period at the moment in between these people trying to get the vaccines in and reopening. As soon as that balance is tipped, and it wouldn't take very much with a highly transmissible virus, you're going to see an uptick in cases.
Yeah.
As Dr. Tam and I said, even with our presentation today, obviously there's over 5 million people who are obviously eligible to get vaccine that haven't received their second dose, right? So they've gotten their first dose. So hopefully it's just a matter that they're waiting for their appointment or whatever, and hopefully they'll obviously go forward to get their second dose. But I guess what we want to also focus on is that why are there 6.3 million, Canadians who are eligible to get vaccine haven't even received their first dose? What are you waiting for? With all the data that we're showing now, Delta variant, and you're just mentioning with the CDC and their studies about how transmissible it is, and even vaccinated people can carry the virus and then transmit to others. Yes, that's all very concerning. I would say that those who are vaccinated and transmit, they're protected themselves, but obviously can pass it on to those who are not vaccinated, and it's those people who are really at risk of getting serious outcomes. I was looking at some of the reports, be it anecdotes, in some of the U.S. states in the South where I think the vaccination rates aren't that low, and you can see young people, children, being admitted to hospital, being in sort of intensive care, and that's so sad in my view. This is all very preventable if people go for and get vaccinated. So let's go for it. Let's go.
Thank you. Merci. Allons à la dernière question. This will have to be the last question. Operator, please.
La prochaine question de Anne-Caroline Desplanques, Le Journal de Montréal. La parole est à vous.
Oui, bonjour, merci de prendre ma question. Je vois que les modélisations ne tiennent pas du tout compte des enfants de moins de 12 ans qui ne sont pas vaccinés encore à l'automne pour la rentrée scolaire. Quelles sont vos prévisions pour les enfants en termes de hausse ou non du nombre de cas? Et donc, vos recommandations à leur égard, est-ce qu'ils devraient être masqués pour l'école? Quelles sont vos recommandations?
Merci pour la question. C'est Dr. New. Oui, c'est quelque chose avec nos homologues des provinces et territoires. Tout le monde est en train de planifier pour le retour pour l'année scolaire. Et ce que je peux vous dire, c'est qu'on attend avec hâte les résultats des essais cliniques pour le vaccin pour les enfants moins de 12 ans. Et je pense que je ne sais pas, je peux pas vous donner une date. C'est vraiment c'est pour les collègues à Santé Canada pour réviser toutes les données probantes pour assurer que le vaccin est aussi sûr et efficace pour les enfants moins de 12 ans avant de peut-être donner une approbation. Mais avec l'approbation, c'est sûr, c'est quelque chose que notre comité consultatif national de l'immunisation va aussi réviser les données probantes avant de donner une recommandation. Donc, je pense c'est difficile à ce moment de vous dire qu'est-ce qui va se passer au futur pour septembre, mais on continue avec le travail avec tous les secteurs, les personnes impliquées pour planifier pour un retour à l'école sécuritaire pour tout le monde.
Mais est-ce que vous attendez à une augmentation du nombre de cas chez les moins de 12 ans avec la progression de Delta?
Oui, c'est sûr, comme on a constaté avec la propagation avec le variant Delta, qui je pense que maintenant avec les cas signalés, c'est la majorité de cas, c'est comme 70%, je pense, même à l'échelle nationale. Donc, c'est sûr que on peut attendre des autres cas avec les enfants qui sont à l'école parce que c'est sûr que ils peuvent être comme contaminés avec le virus. Chose peut-être encourageante, on peut dire à date, on voit que les jeunes enfants avec l'expérience à date n'ont pas vraiment des conséquences, des symptômes très graves avec l'infection, mais c'est toujours une un aspect important qu'ils peuvent transmettre les virus aux autres, comme des adultes qui peut-être sont susceptibles à des conséquences graves. C'est pourquoi on continue à encourager tout le monde admissible de se faire vacciner avec les 2 doses pour une série complète de vaccination. Et on attend aussi qu'est-ce qui se passe avec peut-être un vaccin approuvé pour les jeunes enfants. Mais c'est sûr, oui, on attend les cas. Peut-être